And President Trump today describing several approaches under testing to treat the coronavirus, including a long-established over-the-counter medication.
A drug called chloroquine, and some people would add to it hydroxychloroquine. This is a common malaria drug. It's also a drug used for strong arthritis. This has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very encouraging early results. We're going to be able to make that drug available almost immediately. And that's where the FDA has been so great.
And let me just correct ourselves, and we're going to talk about these drugs. These are prescriptions, but they're generic prescriptions. They're very common drugs. I want to bring in family practitioner Jen Caudle. It's good to have you here, doctor, because I want to ask you about this hydroxychloroquine and azithromycin. It's like a combination of these two drugs. But there's this new study out that says that they were 100% effective in shortening the virus to 6 days, and that there was a 100% recovery for these patients. Are you excited about this at all?
Well, what I'm excited about is that the FDA, the government, and a lot of our health organizations are looking to see what medications we can use to fight coronavirus. And that's really what President Trump is talking about with this particular medication. There are others sort of in that sort of category where maybe we've used them for other things in the past, but the question has come up, can we possibly use them for coronavirus? And what we're doing is trying to figure out ways to consider using them in certain cases. That's what I'm really excited about.
What about children? We mentioned this earlier in the show, that we're hearing more and more about kids getting the virus. Do you think that we made too many assumptions about the kids being immune to this?
Okay, that's a good question. First of all, we've never said that kids were immune to it. So just to be clear, coronavirus can be acquired or anybody can become infected by coronavirus. We've always said that. What we have said is that the people who are older and who have chronic and underlying medical conditions tend to be at highest risk for complications, meaning if they get and when they get coronavirus, they tend to do worse. Children, when they get coronavirus, from what we've seen, have tended to do better. However, what we're seeing now is, well, gosh, actually there are more kids that, or not necessarily kids, but young adults that may be ending up in ICUs and with severe illness. Were we wrong before, I guess is your question, which is a good one. I don't think we were wrong. I just don't think we knew enough. That's the problem with a novel virus, which this is. Novel means new. There's a lot we just don't know. Every day we're learning more. So we're uncovering more as each day goes on.
Well, and that's certainly worrisome for all of us. And I know that we're all worried about getting sick. But there's also been a lot of questions about how to treat yourself if you get the coronavirus. And ibuprofen was recommended before. Now it seems that the medical community is backing off of that recommendation. What is your take on that?
Yeah, and actually there's been a lot of flip-flop in the last couple of days, even in the last 24 hours. You know, I've actually seen now I've seen some reports saying the World Health Organization is now not necessarily saying that you can't use ibuprofen. You know, let me tell you what my thoughts are. Okay, so the idea behind ibuprofen, it's a class of medication called NSAIDs, non-steroidal anti-inflammatory drugs. There's plenty in this class, like ibuprofen. The theory is that medications like ibuprofen may actually change the body's immune system to make it not fare so well if it gets coronavirus, meaning it changes the body and the way the body deals with coronavirus and may negatively impact the patient if they then get coronavirus and they're treated with this medication. A few weeks ago, I was recommending Tylenol and Motrin, or either one, for patients who had mild symptoms of coronavirus. However, new research has come out saying, you know, maybe we should reconsider that. And I, as a result, am changing my stance. Now, look, I think we're going to have some back and forth, and there are some doctors who are going to say, no, ibuprofen is just fine. For me, and what I'm planning to do and doing with my patients right now is I'm going to just play it safe till we have more information and tell them if they can take Tylenol. You got to check with your doctor, but if you can take Tylenol for mild symptoms, I would prefer you do that over ibuprofen until we know more.
That's what they tell heart patients a lot of the time. Dr. Caudle, it's good to have you here. We appreciate your time this afternoon.